This is the Anxiety Medication Group project. We are going to talk about anxiety and how anxiety creates an uneasy feeling of discomfort and dread that's associated with an autonomic response. When we talk about autonomic responses, we're referring to our fight or flight response. It's involuntary. It creates it's our body is not acting normal when this happens, and it's important to understand that it's not something that we can control when anxiety and these feelings take over. With anxiety disorders, not all of them need to be treated with medications. Most of them are going to use a type of cognitive behavior therapy, along with a ERP therapy, exposure with response therapy, and other kinds of therapies like group therapies. So most of our anxiety disorders, you will have therapy like talk therapy, psychotherapy, along with other medications to help with them. So when we talk about anxiety, antidepressants are used a lot. SSRIs are used more than anything to treat anxiety, but antidepressants are definitely used to treat anxiety. It's kind of the first line of prescribed medications by the doctors. They affect the neurotransmitters. They can take up to 4 to 6 weeks to produce a noticeable effect. There's a risk of bleeding when you use any other medications that could have a risk of bleeding. Also, it can cause dangerous reactions with other drugs or certain herbs. Serotonin syndrome is associated. Any drug that increases your shared serotonin, you need to be careful of this. Also, anyone under 25 need to be careful of increased suicidal thoughts or behaviors. They need to be monitored. Also, we never want to stop any of these antidepressants abruptly. You always want to taper off over a couple weeks. Serotonin. The reason why we're talking about serotonin is because it is very important. It is a neurotransmitter that affects mood, sexual desire, appetite, sleep, and memory. So when your serotonin's low, it messes you up and it makes you moody and makes you depressed. Anyhow, so with all of these medications, we're always going to start at a low dose and gradually increase. The first medication of the antidepressants is the SSRIs, which is the selective serotonin reuptake inhibitors, and they increase your serotonin level. These are escitalopram, fluoxetine, sertraline, paroxetine, and citalopram. The first one sounded the same as citalopram, and the last one was citalopram. They do sound alike. That's Lexapro and Celexa. The other ones was Prozac, Zoloft, and Paxil. In talking about all that, we need to know about the side effects. So the side effects, we have nausea, vomiting, diarrhea, headaches, drowsiness, dry mouth, insomnia, nervousness, agitation or restlessness, dizziness, sexual dysfunction, or an impact on your appetite. You could lose weight or gain weight. With all of that being said, we also have the SNRIs, and then we also have the tricyclics. The SNRIs are very similar in their side effects, but the excessive sweating is a little bit different. Anyhow, the SNRIs increase the amount of the two natural substances in the brain that help maintain the mental balance. That's serotonin and the norepinephrine, hence the serotonin norepinephrine reuptake inhibitor. That's the name of them. So we've got two major drugs that we talk about with anxiety, which is duloxetine and venlafaxine. So that's Cymbalta and Effector. So with the duloxetine, you want to make sure you don't have your liver worsen when you take that. And with the venlafaxine, it can raise your blood pressure. Side effects: nausea, dry mouth, dizziness, headaches, excessive sweating. But the tricyclics, so The tricyclics act on approximately 5 different neurotransmitter pathways to achieve their effects. They block the reuptake of serotonin and norepinephrine and work similarly to SSRIs. They're old drugs. They're kind of an old drug. I think they were, I believe, maybe from the 50s. So they've been around a long time. So there are a lot of newer drugs that are being prescribed that have way less side effects. They work for most anxiety disorders. They're, from what I understand, a lot of them aren't as good for OCD, but the clomipramine is the best for the OCD. We talk about tricyclines. We're talking about nortriptyline, amitriptyline, clomipramine, mipramine, and desipramine. Side effects: nausea, vomiting, constipation, blurred vision, and weight gain. Let's see. So next, we are going to talk about benzodiazepines. So with benzodiazepines, there's kind of a lot to talk about. They're not prescribed as much anymore because they're dangerous and they're easy to become addictive to. You can develop a high tolerance, like you can develop a tolerance over time with them, and they're easy to overdose on. So benzos are not being prescribed as much because of how they interact with drugs and alcohol. So they're pretty dangerous because basically they are central nervous system depressants, and they are really good for what they're needed to do, which is to create a sedative, calming, and relaxing effect in the body. But they're dangerous. The big thing benzodiazepines do is they increase the inhibitory effect of GABA on the neuronal excitability. And let's see. So Xanax, Ativan, Klonopin, Valiums are all popular benzodiazepines that are used to treat different panic disorders. I believe they stay in your system. Some of them stay in your system for like 4 to 6 hours, maybe a few hours more, but they aren't something like that's they don't last like a long time. So they're short acting. Next, we're going to talk about buspirone. So buspirone has its own whole class it's its own like drug class, and it is called Buspar. That's the name of the medication. It is a serotonin receptor agonist, therefore it increases serotonin in the brain. It's to treat short-term treatments of anxiety by affecting the neurotransmitters. It is an anxiolytic. It's non-addictive. You do have to be careful with grapefruit and grapefruit juice. Also, it is very contraindicated for MAOIs, but they aren't used very much anymore, so it's not too big a deal. So they are anti-anxiety agent, and they are non-benzodiazepines. So they're basically used like benzodiazepines, but they are non-benzodiazepines, which is great because it makes them much safer. I don't believe you have to have a prescription for them. They might even be over the counter now. So the way that these buspirones help is they help you to think more clearly, relax, worry less, and take part in everyday life. They help you to feel less jittery and irritable, and they may help you control symptoms such as trouble sleeping, sweating, and pounding heart beats. Side effects are dizziness, headache, nausea, nervousness, or excitement. Buspar, very interesting. I just learned about it myself. Next, we move on to antihistamines. So antihistamines are agents that competes with the histamine for the binding at the H1 receptor sites on the effector cell surface. And this all leads to suppression of certain subcortical regions of the brain. When we talk about antihistamines, we really only are talking about hydroxyzine. hydroxyzine for relief of anxiety. Its side effects are dry mouth, constipation, confusion, dizziness, headaches, and the life-threatening ones are unintentional trembling or shaking movements or seizures. So definitely want to look out for that. Next, we are going to talk about beta blockers. So beta blockers are pretty interesting. They are mainly used to treat heart conditions. They work by blocking the effects of the hormone epinephrine, also known as adrenaline. They allow the heart to beat more slowly with less force, which lowers your blood pressure. So this is an off-label drug that's used to treat anxiety, especially social anxiety disorder. Contraindications. So there are too many drug interactions to list here and too many medical conditions to list here. Anytime you're taking these beta blockers, whether it's long-term or just when there is a need to take it before to prevent like an event where you're going to be anxious, it is, you just want to make sure you discuss everything with your doctor so that you can make sure that this drug is safe for you. It can have serious anaphylaxis and skin reactions, heart failure, changes in blood sugar levels can occur. Also, it can add to the effect of the CNS depressant, so you don't want to use drugs or take alcohol with this. Also, really, to be honest, you really don't want to take alcohol with any of these medications that we're recommending for anti-anxiety, because it's just you're trying not to mess with your cognitive and motor skills, and they all have a potential to do that, and you want to make sure that you're not increasing the effects with the alcohol or substances. So with the beta blockers, we have propanol and atenolol, and it seems to me that propanol has been being used for quite some time to help reduce the anxiety symptoms in stressful situations, such as attending a party or giving a speech. But it also seems to me that atenolol has been, they've been doing some studies, and it helps a lot with performance anxiety and it's cardioselective, and it also has less side effects at a lower dose. So I don't exactly know how that's all working out, but it seems that atenolol may be a better choice than the propranolol, but propranolol has been being prescribed for anxiety for longer. Lastly, let's see, with the beta blockers, the side effects, we've got fatigue, dizziness, drowsiness, dry mouth. Also, they could you could have trouble sleeping or nausea or shortness of breath. If you have if it makes you cough, producing mucus or difficulty breathing, tightness in the chest, you need to call the doctor. Last we want to talk about is the MAOIs, the monoamine oxidase inhibitors. They increase the number of neurotransmitters that regulate mood. They are effective as SSRIs and TSAs, but they are not used anymore in general. They are not prescribed because they are very dangerous with certain there's a lot of dietary precautions, and there's also a lot of adverse reactions when mixed with certain drugs like birth control pills, pain relievers, cold and allergy medicines, etc. As far as the dietary restrictions go, they have a really severe effect. They have an adverse effect when they're mixed with red wine or certain cheeses. So MAOIs just are not prescribed very often anymore. They're dangerous, and they can dangerously increase your blood pressure and cause life-threatening side effects. MAOIs include also, well, I listed a couple of these drugs, is like isocarboxylid, linezolid, methylene blue injection, phenylazine, rasagiline, selagiline, and tranliscypramine. Anyway, as far as home remedies go, I mean, chamomile tea is an herb that helps reduce anxiety. I know that you can buy the melatonin over the counter. But yeah, so those are our main anti-anxiety drugs, and somewhat how they work and their side effects.